dialogues that we have called for is essentially for us to connect further and better with our partners. As the new executive director who has started about 5 months ago into this role, it is my great pleasure to come before you to share some updates on what we are doing, some of the key priorities for us in the coming weeks and months. But importantly, this is also an opportunity to hear from you, from the constituency leadership, from you as members of the Partnership for Maternal, Newborn and Child Health in terms of how these issues are manifesting themselves in your different domains in the countries and contexts that you work in. And it is my great pleasure to also welcome our two guests who are joining us, Kate Gilmore and Ann Stars, who will be in a moment joining us and outlining for us the work that they are undertaking for the partnership in terms of the external evaluation and governance review processes that are underway. And we will talk about that and a bunch of other things during the course of the next 2 hours. Colleagues, this is a dialogue, which first part of which we had this morning. And it was an incredible honor to meet the colleagues from different constituencies, mostly coming in from Africa and Asia, to hear their perspectives and to hear their views on how things are happening, how we can strengthen cross-constituency collaborations, and to share with them also some of the updates of our ongoing work and priorities. We'll go through some slides, and at different points in the agenda, we have factored in moment for us to have a dialogue, open up the flow. May I please request, just because there are a lot of people who are joining these calls, if you could please keep your microphones to mute if you are not planning to take the floor. And if you do want to make an intervention or have a suggestion, do please kindly use the chat function or raise your hand and I will come to you as soon as possible during the intervention. Colleagues, could somebody please give me a thumbs up if they can see my screen and the slides that are. Thank you, Naveen. The agenda for this meeting has been outlined as follows. We will have a brief overview from myself and our two guests as I identified. And from that, we will promptly move into updates from different constituency leadership that are present to us. And my enormous thanks to all of them for joining us today. They joined us in the morning session as well, as I mentioned, but a lot of them are also joining during their holiday time period as they celebrate the festival of Diwali and other festivities that are underway. We will then have some time for a cross-constituency dialogue to hear how we can strengthen the work of the constituencies further, better, where the opportunities are. And then you will hear from the Secretariat about different activities that are undergoing in terms of the country work, in terms of the Global Leaders Network, implementation of the WHO resolution on maternal mortality, and so on. And then we have more time to have your feedback and dialogue on different aspects of the work that we are undertaking. Colleagues, if you do have anything that you think is missing or is incorrect in the agenda that you would want us to address, please do pop it in the chat and we will make sure that we identify ways to address those issues that there are. Given that we have several new friends and colleagues and new members that have joined the partnership, one of the things that was requested of the Secretariat was to give a brief overview of our partnership and who we are, what we work, and what is it that we do essentially in different areas. As you all probably know, the partnership is the world's largest alliance working on women, children, and adolescent health issues. We are hosted at the World Health Organization here in Switzerland, Geneva. The partnership today is 1,500 members strong and operating in, as you would see, in about all the countries in the world that we have partners in all the 6 regions of the world today. The power of the partnership comes from its convening ability to have this diversity of partners working in countries in global north, in global south, in all the regions of the world, but also connected through this common purpose to address the challenges related to women, children, and adolescent health issues. And the partnership is cascaded into different constituencies through we work. And you will hear from the leadership of some of these constituencies in a moment. There are 10 constituencies that we have, and we are the only partnership that exists today working on women, children, and adolescent health issues who've got all these partners together. We've got governments, we've got UN agencies, we've got civil society, but we also have got private sector and young people, and we also have people working in context of global financing mechanisms and research organizations, etc. The challenge, colleagues, for us is how do we leverage the strength of this partnership, the 10 constituencies, the 1,500 partners strong that we are to deliver for the women, children, and adolescents of the world, and where are the opportunities, but also where are the challenges and tensions that we need to address as we march forward in this space, given that we all very well know that the challenges that the women, children, and adolescents of this world today they face are magnifying themselves. The progress has stalled over the last few years, but the progress has also reversed in a certain regions of the world. Colleagues, we also, as within the present strategic framework, we are in the last year of it. It goes from 2021 to 2025. We had identified a mission to be one that delivers for every woman, every child, every adolescent to be able to realize their right to health so that no one is left behind. This vision is then translated into the work that we do in terms of addressing the maternal, newborn, and child health issues, the sexual and reproductive health and rights issues, and the adolescent health and well-being issues. We work towards driving the reduction of preventable mortality and morbidity for maternal, newborn, and child issues. We work towards addressing the violations of sexual and reproductive health and rights, and to ensure the advancement of adolescent health and well-being. And this is then broken down into specific areas through our work plan. And what you have in front of you is a present strategic framework and the theory of change, through which we have identified different inputs, outputs, and measures through which we address the veracity of issues that we are talking about. The tactics that we use are those of knowledge synthesis, partner engagement, advocacy, and communication to make sure that the needs, the aspirations of women, children, and adolescents in different parts of the world are addressed and that we are able to achieve meaningful gains in these areas. I will not go through the details of this. The slides will be shared with you after the sessions are done. The work plan, as I mentioned, for the biennium is one that was approved by our board. And as you know, the board is headed by Right Honorable Helen Clark. And we did do a further revision of the work plan after the July board meeting to bring in further specificity. And one of the key conclusions that the July board meeting asked us to do was to ensure that there is specificity on how we will work towards ensuring an acceleration of reduction of maternal, newborn, and child mortality, and what that would look like, and how would we link through that the other two thematic priorities, that of adolescent health and well-being and sexual and reproductive rights, so that we are able to achieve meaningful change in different areas that we work in. So through that, we have got different portfolios of work that has been identified, looking at knowledge synthesis and outputs, knowledge summaries that we produce, how we will do partner engagement, working closely with ENAP PMM, the Child Survival Initiative. Of course, now ENAP PMM has got a new branding, the EDINI initiative, as we call, but also through our campaigns and outreach work, through which we work at the country level and also through the global policy advocacy work that we do. One of the key highlights of the July board meeting was looking at our collective future together. How does the partnership march itself into the future, not just the next 14 months, the priorities of which you just heard me outline very briefly, but how do we move at the end of the next strategic period, not only to the next 5 years, that is 2026 to 2030, but how do we make sure that these issues become continuous priority through which we work to ensure the health and well-being of women, children, and adolescents. So there are three things that are important to share with you, and I will turn over to our guests in a moment. The first is the governance review that the board had asked us to convene. Through the governance review, what the board has asked for is a simplification to bring in more agility to the way we function so that we can deliver more effectively for the women and children of the world. The second is the external evaluation. We are coming to the end of our present strategic period. What are some of the learnings? What are some of the successes that we had? But importantly, what are some of the lessons that we need to learn so that as we march into the future, we march strongly together into that future? And then finally, is what are some of the strategic priorities that you all, our partners, our leaders, want your secretariat to focus upon? Through that, we are leading a consultation with the partners and with the 10 constituencies to hear from you. Where do you see are the priorities for this next strategic time period that we can deliver upon? With that, I will pause here for a moment and hand it over to you, Kate, first. And after that, I will turn to Anne and Jesse for their reflections as well. And Kate, over to you. Kate, we are not able to hear you. You might be on mute.
I'm so sorry, Rajat. I knew I was on mute. I just couldn't find the microphone. Hello, everybody. It's not a good introduction to somebody reviewing governance that they can't switch on the microphone. I apologize for it, but I'm so grateful to be here. I feel very privileged indeed to join you this morning, this afternoon, this evening, and thank you for the opportunity to contribute. As Rajat has already explained, the governance review has been commissioned by the board and reports to the board more as a project to design or recommend design of governance for the future than an evaluation. I think it's quite important to stress. So it's a very future-oriented approach that's being asked. And it's observing on the behalf of the board, at least, that at the moment governance is heavy and possibly cumbersome, and therefore not empowering and enabling PMNCH, and in particular the Executive Director and the Secretariat, to be agile in a rapidly changing world. That's the heart of it. The board has asked for a design that is more streamlined, but still inclusive, simpler, but still effective, and a design of a governance process that can win the confidence of partners, but not be a substitute for engagement of partners. Now, we've adopted a light methodology for the review, centering principally on advice, wisdom and experience of key stakeholders, those who are familiar with the governance approach as it stands. And we've augmented that with surveys of participants in the governance system, with consideration of best practices elsewhere, and with a strong focus on the world that PMNCH needs to impact on. And this is where the governance review meets up with both the evaluation underway and the new strategic direction that will unfold and towards which Anne too is contributing significantly. We will report on the governance piece to the December board meeting. And at that time, hopefully, provide the board with some options as to what they might wish to put in place for the governance review, from the governance review for governance into the future. If at any point in the coming weeks you have views that you would like to share on the future governance of PMNCH, please don't hesitate to do that. I'll leave my email address in the chat box, but of course your constituent leads and representatives on the board are very important pathways for you to make sure that your views are heard. And further, please reach out to the Secretariat if you have any concrete suggestions. But for now, Back to you, Rajat, and thank you.
Thank you. Thank you so much, Kate. And for colleagues also to know, Kate and Jesse are going to be with us for a little bit more time. And in case you do have any immediate reactions, feedbacks, or counsel for them to consider as they develop their work, please do share with us. And as Kate said, she will be sharing her email address in the chat function right now. And then we will also hear further from the other team evaluating the strategy. And over to you and to Jesse as well.
Hi, all. I think I can start.
Yep, I was going to say Jesse should go first because that's the order.
Great. Hello, all. My name is Jessie Clyde. I'm a consultant for Global Health Visions. I have a background in sexual and reproductive health and rights with a focus on evaluation. As you've heard, GHV has been asked to carry out an external independent evaluation of the current strategy, which I am co-leading with my colleague Priya Nanda. And as Rajat mentioned, the evaluation is focused on, identifying where the partnership has had the most success and what are potential areas for improvement, with an eye very much towards being useful for the next strategy. And Anne will share more about that process in a minute. Super briefly, the evaluation has 3 parts: a desk review of donor reports, annual reports, past evaluations, etc. Approximately 20 interviews with board and executive committee leadership, working group and workstream leads, constituency representatives, and donors. And finally, a short survey with partners that you will receive today, and I very much encourage you to complete. You all are the partnership, and your feedback is really critical to make this a robust evaluation. So that's my plug. A little bit about the questions we are exploring through the desk review survey and interviews. We're looking at key achievements and challenges for PMNCH's advocacy work on maternal, newborn, and child health, SRHR, and adolescent well-being. Looking closely at how knowledge synthesis, partner engagement, and campaigns and outreach contribute to that advocacy. We are also exploring PMNCH's unique sort of value globally, regionally, and nationally, and really interrogating, to what extent it facilitates that local to global connection and vice versa. The evaluation will also include an assessment of the work on accountability. And finally, it will dig into PMNCH's approach to both communications and measurement. So we're still in the process of collecting data. We are going to share some preliminary findings with the executive committee in mid-November in preparation for the December board meeting. But, again, a big thank you for including me here today, and I hope I have the chance to speak with many of you and listen to your reflections. I think over to you, Anne.
Thank you. Indeed. Thank you, Jesse. And as we hand it over to you, Anne, just to tell everybody, the link to the survey questionnaire has been posted in the chat function. So for colleagues to familiarize themselves with that, and we will, as a follow-up to this call, share it with you via emails as well. Over to you, Anne.
Great. Thank you, Rajat. Thanks, Jesse. And thanks, Kate. Great to be part of this illustrious effort. So I also am a consultant with Global Health Visions. The contracts for the independent external evaluation and this strategic prioritization, strategic directions process are of course closely linked. So we are working together on these efforts, although also maintaining a firewall of distinction between the two processes. So I have been working in SRHR for most of my career, but also maternal, newborn, and child health. And I have been part of PMNCH since its founding. So I have a deep and affectionate engagement with PMNCH. So I am leading this strategic prioritization exercise. Ours is simpler than the external evaluation. So we are conducting a series of interviews with key stakeholders as well as focus group discussions. They're being coordinated with those that are being conducted for the external evaluation. while, as I said, maintaining a, a division between the two work streams. So the strategic prioritization interviews cover questions on the global context for PMNCH's work and mandate from 2025 or 2026 to 2030, looking at PMNCH's thematic focus areas, its unique value in global advocacy, as well as national advocacy for MNCH, SRHR, and adolescent well-being, as well as recommendations or ideas for key advocacy outcomes that PMNCH could prioritize in these areas. We will also be looking at the balance between global, regional, and national focus for PMNCH's work. We are interviewing board and executive committee leadership, working group and workstream leads, constituency representatives, and current PMNCH donors. We're still in process. Most of the interviews are complete, but we still have some focus group discussions that we'll be conducting next week. And as with the other two work streams, we will present preliminary outcomes to the executive committee in November, but the full report will be shared in December. So I think that's it. Back to you, Rajat.
Thank you, Anne. Thank you, Jesse, and thank you so much, Kate. It's really a privilege to be working with you all. And as we come to a close of this segment, and before we turn to the constituency leadership to share some reflections, a couple of issues to highlight. One, in terms of the process, as colleagues have highlighted, that the timeline is very short. Extreme gratitude to the three consultants for accommodating us in this short timeline to that the first draft of the report will go to the EC and then the final draft to the board early December. Important in this regard is to highlight that the processes are both overseen by board subcommittees themselves. The external evaluation is being seen by a board subcommittee led by our chair, Right Honorable Helen Clark, along with Mike Mabisbo representing ART constituency and Kathleen Sherwin representing the NGO constituency. The governance review is directly overseen by another subcommittee, which is led by UK, India, CSOs and UNA constituencies, and therefore represented by Chris Carter, Aradhana Patnaik, Maria Antonetta, and Anshu Banerjee. And it's important not only in terms of the process, but also maintaining the integrity of that process. The last thing I wanted to say is that your voice matters a lot. So please do engage in this process. We want to hear from you. The survey questionnaire link is available to you in the chat. We will follow it up after this conversation via email as well. But also, as Kate said, if you do want to talk directly, as I'm sure Anne and Jesse would be happy to accommodate as well, do please reach out to the Secretariat or to them directly as you may wish. Before we branch into the next segment of the conversation, I just want to take a quick pause in case there are any clarifications or urgent questions that colleagues have from our review teams before we went into the consultations, the constituency feedback. We do have a lot of time after that to have an open discussion about everything, but just want to check if there are any immediate questions, concerns, clarifications. I see no hands, but if you do have on reflection, pop it into the chat and we will definitely. Oh, I do see you, Dr. Ikchoibu. Please go ahead.
Thank you, Chairman Raja. I'm Dr. Ikechukwu Onyekwolo, the president of Redeem Community Health Council, or Redeem International. And we are based in the West African sub-region, particularly in Nigeria, where we have invested a lot of resources in maternal and newborn child health. But there's something I want to point out because you hinted on something regarding governance. I see that the partnership has made a lot of progress in terms of delivering on promise. But there's something I want to let us know. African sub-region particularly, is underrepresented in the World Health Assembly. I have pointed this thing out several times. For example, there was a particular position that was slotted to Africa, was zoned to Africa about 7 to 8 years ago. And I was surprised when the voting came up. It was again generalized, and other organizations were allowed to contest from outside Africa sub-region. And what happened? Eventually, a Bangladeshi won that particular election. And is it fair? A post that was slotted to Africa, zoned to Africa, a Bangladeshi won that particular post, and the Bangladeshi lady is now representing Africa. Is it fair? It's not fair. So I just felt that I'll use this town hall meeting to at least sound it loud and clear to the partnership, so that at least we take a look at it with a view to at least considering Africa in terms of representation, because we are underrepresented at the World Health Assembly. That is the point I want to make. Thank you so much.
Appreciate the point you've made, Doctor, and indeed it is important to ensure representation from the regions and from where this is impacted. While I will not comment upon the World Health Assembly, I do want to ensure that you feel assured that for the partnership, we do take these issues extremely seriously to make sure that when we do look at our structures, our constituencies, our working mechanisms, that there is good representation from all the regions. But you have the evaluators here with us who I'm sure taking note of it. So I don't see any other hands at this point. And in the interest of time, because we have a lot we want to cover with you, I do want to move into our feedback from our constituency leadership. And if I could go to you, Naveen, first, as the co-chair of the HCPA constituency for your initial remarks, and then I would be coming to other constituency leaderships. Naveen, over to you.
Thank you, Rajat. I am speaking here on behalf of our constituency chair, N. Kihara, who has bad throat and not able to speak today. So our healthcare professional constituency is very unique. And as Rajat said, it is the only platform where those who healthcare professionals who care for mothers, children, newborn and adolescent come together. I have not seen any other platform where we come together, and we all of us represent millions of healthcare professionals committed to do our best for women, children and adolescent health. And as if I say for IPA, we International Pediatric Association, we represent 1 million pediatrician and 175 member society from more than 155 countries. So this is unique. And our chair and our board members with secretariat have once we took over with the new in the new board, we immediately have decided our priority, constituency priority, and the first priority our chair has defined is healthcare worker. We is to be a work as a healthcare worker professional team fit for the purpose. And PMNCH provide a great opportunity for us to discuss together how to deliver as a team and how we represent each other. So this is our first priority, key priority. Second is that what we feel we are a healthcare professional team, we can only deliver if we work closely and supported by other partners, government, private sector, CSOs, youth, etc. So and they listen to us and help us to advocate for our needs so that we can be the best, do the best for the women, children, and adolescents. And there are many examples where it worked, but still much more needs to be done. In this spirit, we are very happy to contribute and lead to cross-constituency activities. One promising opportunity is to collaborate with the adolescent and youth constituency as we see more and more need to upgrade ourselves. We are also excited with Global Leaders Network work to see our agenda being elevated at the highest political level. And thank you so much, PMNCH, for doing that. So a few highlights from our work this year. We have had 3 extended leadership meetings of all HCPA representatives across PMNCH governance structure, one dedicated to youth HCPA meeting, second to full constituency meeting to align our asks and contribution, and to meeting full constituency meeting. We issued a survey to HCPA leadership organization to identify gaps and synergy within our own work with a key aim to see how healthcare professionals can deliver as a team, which is our key priority. We are coordinating on key events for the professional organization and how best we could collaborate across association, bringing nurses, midwife, OBGYN and pediatrician together. We are part of each other's academic events and also taking part in each other's say conferences. We are actively engaged to diverse PMNCH products and activities represented our constituency by our chair N. Kihara, Sandra, and myself at the July board meeting, calling for what we termed as calling for a business unusual. If we really want to move the needle, it has to be business unusual. Some examples of our planned PMNCH activities, MNCH resolution implementation, including in the CAP countries. We have been part of the PMNCH coordinated efforts to adopt the resolution, and now we are engaging in fostering its implementation as part of global and national effort. And we have issued a statement of support from our as a constituency, bringing all the professional association immediately after the adoption. And we are also working very closely with WHO, ICM, and FIGO on addressing postpartum hemorrhage. And in Kenya, recently held a session sharing valuable lessons learned. PMNCH policy dialogue. So this is very unique initiative we are starting. First one is on health workforce in November 2024, followed by SCPA organized convening series throughout 2025 to discuss and agree on how as health workforce we do deliver despite all challenges and obstacles, and what innovation and partnership we can leverage. There are 8 topics we plan to zoom in. A young HCPA survey, this is very unique. We have seen some initial work, and this is going to bring, they are planning to do a global survey to identify the challenges young healthcare workers face globally, highlight best practices, and assess their investment priorities. And this will be a very good survey which will bring to us what the young HCPA wants and what they need. Evidence and knowledge, we are part of the advocacy briefs. We are building on last year's success with Global Forum for Adolescents. We are engaged with follow-up on action agenda for adolescent. Another critical agenda we are reverting to see, we are advancing in the respectful care. As I said, we issued a statement for that. And here I will stop. As told, this is a big festival time in India, and because Anne is not and was not able to speak, so I just chipped in. But we have our, I hope Anne is there, and we have Dr. Errol Eldon, who is the who was chair last time. So they will be available to answer your question. And as Deepavali Festival of Lights, we wish that there is a light and in every part of the world, and together we achieve for work for the mothers, children, adolescent, and newborn. Thank you so much, Rajat, for the opportunity.
Thank you so much, Naveen, for the remarks, and particularly appreciate you joining in during the festival time period. Much grateful for your time and counsel, and And thank you also to Ann Chiara, who's joining us in spite of being unwell, and grateful for you to answer any questions. Colleague, do keep your questions and comments ready. We had a very robust discussion this morning on cross-constituency collaboration, where we are doing good, where we can do better. So I hope we can replicate that spirit in a few minutes. But before we do that, I have a few other constituency leadership who would want to share some reflection. And maybe I could go to you next, Maria Antonetta, representing the NGO constituency, and then come to Marlene from ART. Maria Antonetta, over to you.
Great. Thanks very much. I'm Maria Antonieta Alcalde. I'm Mexican. I'm joining from Mexico right now. I couldn't join the morning meeting because it was 1 in the morning in Mexico, but I'm so glad to be here talking about the NGO constituency. The NGO constituency is the largest constituency of PMNCH, but it's a great honor to represent. And also it's like it has a lot of power, and at the same time it's a challenge to bring together the constituency, a challenge to work on the cross constituency work, and that's something that is one of our priorities for the leadership of the constituency. A big part of our work is to try to harness the potential of the NGO constituency for different priorities, and I don't want to take a lot of time, but I just want to give you some examples of the work that we've been doing and that we want to do more. Things like maybe some areas of work are, of course, advocacy efforts. I mean, PMNCH is about advocacy, but it's about advancing the agenda, and the role of the NGO constituency is to like really to lead on those efforts. Convening stakeholders, it's another area of work. Capacity building, and of course representation of the NGO voices in different forums. So some examples of the advocacy efforts that we have been engaging in. Of course, that, like, as all of you know, the last World Health Assembly was crucial, especially the resolution on reducing maternal mortality. And during and before the WHA session, we convened the NGO constituency got together. We convened a meeting with all the NGO that were planning to get involved in WHA, or like also in Geneva later when they were already like there, to ensure that we had a common agenda, to have a common strategy on how to address and how to push for a strong resolution on maternal mortality, and that was very successful. So that's one example. Another example maybe was like the webinar that we did on the Summit of the Future, knowing that many of the NGO constituency members were involved in the negotiations and in the planning for the Summit of the Future. We took the opportunity and we had a webinar where like some of our colleagues explained kind of the latest news of what was happening in the negotiations in New York, and also what was to expect. And that was very, very important, because then the NGO members, that many of them are national organization or local organization, could take that knowledge and advocate for their governments, and also use that framing to advance the agenda at the national level. And that's always a challenge, and it is a priority for us, how to ensure that we build strong bridges between the national realities, and to ensure that we use all the advances that we have at the global level to push for stronger laws, policies, regulation on a PMNCH agenda at the national level. And this is something that we hear over and over from the NGO constituency. We want to be part and to contribute to the global agenda, but we also want to have tools and have like the information and the resources that we need to ensure that we bring that agenda home. So that bridge is something that we have been building. So those are some examples of the advocacy efforts. On convening stakeholders, that's something that is also a priority for us. We want to take any opportunity that we have to bring people together, to talk with other constituencies. We work very close together with the adolescents constituency, and we're always proud of it. In different moments, we had organized, for example, webinars on adolescent well-being, or like a platform. And this is something that we want to keep doing. some constituency members from other constituencies, like the private sector, have been approaching us, wanted to have a conversation in terms of how can we work together better, and that's another priority for us. So convening stakeholders in Nairobi, many of you in the preparation for the Summit of the Future, the NGO, the Civil Society Conference in Nairobi, we took the opportunity, and some of the members of the leadership, and thank you to Plan for like helping us with that, convene the people in that we're planning to be in Nairobi. So advocacy efforts, convening stakeholders, capacity building. And the last one that I want to mention is representation. Like I have been, like many of the members of the NGO constituency have been part of efforts and representing the voice of the NGO in different efforts of PMNCH. One example is I had the privilege of reading a statement on behalf of the NGO constituency at the launching of the Global Leaders Network in New York in September. And I think it was important to be there and to, to support the initiative, but also to be able to say that we're planning to make this initiative accountable, and that we are ready to work with the global network, global leaders network, and at the same time we see ourselves as our role to make them accountable. So those are some examples of the work that we do and that we're planning to keep doing in collaboration with the other constituencies and with the Secretariat.
Thank you enormously, Maria Antonietta, for all the work that you do, and especially for bringing in the point about linking the global to the national. And in a moment, we will hear later in the session about the CAPS work and how your secretariat is trying to enhance that link between local level advocacy and mobilization and linking it with global policy efforts. And we'll come to that in a moment. But before that, let me turn to you, Marlene, next for your reflections from the ART constituency perspective. Over to you, Marlene.
Thank you, Rajat. Colleagues, greetings from Nairobi. And I'm representing the ART constituency on behalf of my colleagues, Mike Biswo and Nelam Daka. So we are happy to see that now currently more structure is brought into the cross-constituency collaboration, as this is something that ART has been asking for a very long time. So we are happy to contribute to cross-constituency activities and products in the future. We also, as ART, would appreciate clarity on what PMNCH governance is expecting from the constituencies and how they should be best and most efficiently participate in the cross-constituency work. ART consider itself as a resource to the Secretariat and would like to ensure it is used effectively. In 2020, we contributed to the development of advocacy briefs, finance the papers, and the reports. And Etienne will give you more details later in this session. ART provided also feedback to the PMNCH work plan and deliverables and contributed to the development of all 3 PMNCH discussion notes. We provided review on the WCA economics and finance evaluations, and ART was represented by Mike Mbizwo and Gamal Serur and myself at July 24 board meeting. ART has 204 member organizations across 53 countries. And, sometimes that's great. We can say, wow, we represent all these organizations. But from my own experience, when I'm reaching out to my colleagues here in universities and research organizations in East Africa, it's not always easy to explain or to convince people who could bring value on, in joining. They always ask, but yeah, there are so many partners, platforms, what is in for us? And I don't mean financially, but how can our group become stronger in joining the ART or joining PMNCH? So I think the the CAAP, the CAP, will surely contribute maybe to better understanding in the countries and in the regions what PNMCH is all about. Because, as I think I've said this earlier this morning, I'm very happy that now it will be presented later. There is more effort through the CAP to the CAPs in working in countries, because from my own experience living and working in Kenya, I see a lot of PNMCH Kenyans in Geneva, in New York, in London, in Delhi, but till recently we never met in Kenya. Kenya doesn't know what PNMCH is. Of course, we ourselves, we know, but so I'm so happy to see that now through more efforts into bringing the PNMCH to a higher level in countries, I think this is really a game changer for the work of PNMCH. In the current format, ART contributes and plans to contribute to PNMCH activities in two main ways: responsive, ad hoc, for products, interventions, activities that are requested by organizations on our topic. So, for example, the Zambian Parliament to update on the MCH issues. ART presented a brief, and this was presented in Parliament, which was a great reach out. Then, besides the ad hoc, we also plan to contribute, as we did in the past, to planned PNMCH activities, products, briefs, resolutions, policy dialogues. And we would like to do that even more with other constituencies. And the constituency that is close to us is the knowledge, evidence, and accountability. And we are even thinking maybe we belong there. We can work with them, but there is so much overlap. Maybe we have to reconsider in the future whether we need a separate ART constituency. So then a few questions I think that we can have for this dialogue. How are the constituencies working to engage a very broad range of members rather than just the usual characters? And I refer again to the CAPs that are contributing to this. Number two, where is there space and opportunity for individual and collaborative constituencies to work more significantly on products and events related to our topics? Very often we are asked to comment, to provide a few edits on existing products, but it would be good to understand who takes the leadership, which constituency takes the leadership, and how do we work with others. Of course, we are all focusing now, and I think that's good, on maternal mortality, because we are not doing well in many countries. Kenya is doing poorly. So we need to bring everyone together around these topics. And I think the IWINI is contributing to that. So I'm happy to be a very active member with the Ministry of Health in Kenya and to go to the meetings. And there I can represent, of course, my own university, but I'm always bringing PNMCH on board. And so to make sure that PNMCH is known more in this space as well. So I think that's, and how can we do better, not only because as an advocacy platform, we don't need to do the research, right? We have plenty of partners in our own area. Look at WHO, HRP, they provide, and others, many others provide the evidence. So what our task is really to translate the evidence, to synthesize, to do the knowledge translations, to bring it into context, and to use the data to enhance policy and practices. Because, just to end, this is in my experience, not only for PNMCH, but everywhere. Whether now you work in academia, you publish. Whether you work in politics, you have resolutions. In the global politics, we make guidelines. We do so many things in the world. Then we go to the countries, and Kenya is, in my view, really a champion in guidelines on each and everything. But if you look at all the guidelines and the implementation of it, it's not, in balance with the impact. So we need as PMNCH also to think about, yes, we can make a lot of noise, but how do we do better in impact? So this is my contribution. And I'm sorry, I can't stay to the very late, to the next sessions. I will stay another 15 minutes and I have to go.
Thank you. Thank you, Marlene. And thank you also for joining this morning and really critical points, both in terms of how do we become more results and impact oriented, as you ended your statement with, but also I think some fundamental points that you raised. And I will invite Kate, Anne, and Jesse in a moment to have their reflections, if they have any, in terms of these ideas about, how can we bring better alignment, synergies on how we look at the way we are structured, our governance structures, particularly to facilitate a better impact model that we'll be working with. Colleagues, we do have two more constituency leads who will be sharing some reflections with us, and then we have a few minutes to hear from you, any reaction from what you have heard, before we turn to a bunch of updates from Secretariat on different portfolios. Next, I have Garrett Jones representing AY constituency. Unfortunately, we don't have a private sector constituency lead right now, so my colleague David Gomez will be leading the intervention on their behalf. But first, over to you, Garrett. Thank you.
Thanks, Rajat. Thanks, colleagues. Happy to be joining you. Apologies, I couldn't join the first one. It just clashed with some other commitments, but between Hafsa and I were able to be present at both. So as the AYC, we've been quite deeply engaged since the beginning of the year in several activities with PMNCH, including multiple rounds of input and feedback on the work plan, and also discussing new ways to engage with the constituency membership and promote cross-constituency collaboration, which I'm hearing a lot about, which is great to hear. The new AYC leadership was selected and onboarded in the middle of this year, so in June. So that's a new chair, board representative, vice chairs, and secretary. So Hafsa is now the chair of the AYC with myself as the other board representative. We also participated in the board and EC meetings in June and had some productive discussions with colleagues. We've been actively contributing and plan to contribute to activities in the work plan, particularly looking at pieces of work such as the change from the 1.8 billion Young People for Change campaign to the What Young People Want campaign. So we've co-authored a blog discussing the next steps and the importance of this change for the campaign. We've been contributing to different events for UNGA, so events on meaningful youth engagement, adolescent sexual and reproductive health and rights. We also led the development of the Call to Action 2.0, which was launched at the closing session of the Youth Power Summit. The Youth Power Summit, which was held along the margins of the UN Action Days at Summit of the Future, sought to bridge the gap by providing a platform to young people to voice their aspirations and priorities for their well-being and the future. So building on discussions and milestones such as the Global Forum for Adolescence and the What Young People Want campaign, the Power Summit spotlighted actionable steps and solutions to inspire progress on adolescent well-being. It emphasized the need for adolescents and youth to be central to shaping policies and decisions that directly impact them, ensuring their voices lead the conversation toward meaningful change. So this session and the Youth Power Summit more broadly concluded with the launch of a critical statement by youth leaders at the concluding session of the summit. So this call to action builds on the commitments successfully delivered by PMNCH partners as part of the Make Adolescent Wellbeing a Priority, the call to action launched in 2019. This call to action was also aligned with the Agenda for Action for Adolescents, the Pact for the Future, Declaration on Future Generations, and the Cotonou Youth Action Agenda. So it also all these agendas supporting each other, and it also lays the foundation for action in the lead up to 2030 and the post-2030 era. The call to action itself emphasizes the need for increased evidence-based investment across all facets of adolescent well-being, so health, education, connectedness, safety, and employability. And all governments and all stakeholders must commit themselves to comprehensive nationwide plans that enhance adolescent and youth well-being through whole-of-government multi-sectoral approach. And with the cross-constituency working that we've been referencing, we really hope that all constituencies can take up the call to action, and as the AYC, we're very happy to work very closely with all constituency members to support the uptake of the call to action. And again, part of our work has always been that the work on adolescent well-being also feeds into the work on SRHR and MNCH. And very happy to work with colleagues to see how we can promote all agendas through this work. The call to action reiterates the need for meaningful engagement of adolescents and youth, and how adolescent and youth issues are core to shaping the post-2030 agenda. And we're really trying to decrease and remove those barriers to participation in UN processes and other processes. And we've also more recently reiterated the need for meaningful adolescent and youth engagement through video interventions at the IPU Assembly that was held in Geneva. And a few weeks ago, I was also participating at a pre-G20 event here in Beijing on adolescent and youth innovation, looking at adolescent well-being to drive work on inclusive education and education fitting the needs of adolescents and young people. Looking ahead towards the end of this year, the new strategy process, and 26 to 2030, we're really eager to work on ways to engage members in more activities that look across the constituencies and build a really strong foundation for delivery on the strategy that will be developed. We're also keen to collaborate on activities and deliverables with other colleagues. As PMNCH has been a flag bearer for the adolescent wellbeing space and public health discourse, the international work on maternal and newborn child health and SRHR, together we think it's really important that we maintain this focus and particularly continue to be a champion for adolescent wellbeing. Over the last 5 years or so, we've built a very strong foundation using an evidence to policy approach for promoting adolescence as a key and the longest life stage longest stage in our lives. This needs continued focused attention if we're to achieve better well-being outcomes, but also more needs to be done to keep the momentum going that we've built. We had a great event last year at the GFA. I still have discussions with colleagues, with partners on the impact of the GFA, particularly at country level, how they've been able to build on national events, continue conversations, mobilize further commitments from government. And so we really need to make sure that we keep that focus on adolescent well-being. And as the AYC, we're very committed to supporting that and supporting the focus on adolescent well-being and the new strategy and its intersection with SRHR and MNCH. So I'll hand over there, Rajat, and of course happy to answer any questions. Thanks.
Thank you enormously, Garrett, for that, and really for ensuring that we as the partnership stay on course for our commitment to adolescents and young people. And really thank you enormously for all the work that you do in terms of championing these issues, not only within our network, but beyond as well. And for those of you who were not able to attend the Youth Power Summit in New York on the sidelines of UNGA, one of the best events, if I may say so, that there was in this regard. Last but not the least, a constituency that we haven't often talked about, but which is increasingly becoming a very vibrant space, which is co-chaired by Ferring Pharmaceuticals and by the World Economic Forum. Unfortunately, Charlotte is not with us at the moment, but she might join us momentarily and will be with us for the second part of the conversation. So the intervention will be quickly read by my colleague, David Gomez. David, over to you.
Thanks a lot, Rajat, and good afternoon, everyone. It's my great pleasure to be here speaking on behalf of the private sector constituency leadership. As it was shared this morning, the private sector constituency is undergoing a very exciting developments, almost like a fresh start with some very promising opportunities, starting with a new leadership. We're bringing new co-chairs on board, and it is our pleasure to introduce Dr. Poonam Dordana. She's the CEO of Kuri Research and Development from Pakistan. Some of you may have seen her yesterday during our dialogue series, Ready, Set, Implement, where she brought some great examples on how private sector can be part of the whole ecosystem on advancing the health and well-being of women, children, and adolescents. We're also proud to welcome Divine Nakpal. She is our under 30 vice chair. Some of you might know her as well as She is championing great work under the Global Alliance for Women's Health representing the World Economic Forum. Right now, as constituency, we are engaging on a series of multi-stakeholder listening and exchanging exercises, starting with the NGO constituency, as Maria Antonietta mentioned. But after the conversation from this morning, we're also very excited to see that a lot of other constituencies are very eager to participate on these multi-stakeholder conversations between our private sector members and the other constituencies. The idea here is to explore how private sector can more efficiently support our shared agendas. And we can plan to organize a series of roundtables to build a new partnership model, clarifying the private sector purpose and value in a broader WCH ecosystem. And we are committing to exploring how private sector can contribute beyond philanthropy, but through solution, capacity building, financing, and co-creation. We acknowledge that there have been some sensitivities and some reluctance in welcoming private sector as an equal partner. So moving forward, as constituencies, we are focused on addressing these concerns directly, establishing a clear pathway that defines how we can foster trust and engage meaningfully. This collaboration model aims to create transparent and secure space for partnerships, ensuring that there is no hidden agendas and that all parties feel comfortable and respected. We're also championing private sector roundtables. The idea is that this will help us expand our private sector membership and also bring more diversity into our community. So we are keen to deliver real impact on the ground and where is most needed. So we look forward to work openly and transparently with other constituencies to define effective partnerships with the private sector. Finally, the time is actually very, very ideal, as we can see that some of our partners, including the Ferring Pharmaceuticals, the World Economic Forum, are working on an activation program that also aims to address postpartum hemorrhage in several countries, a lot of them overlapping with our priority countries as the CAPs, as it is the case of Nigeria and others. So this is all for me. I see that our colleague Charlotte is already here. She probably missed the first half, but I don't know if she very quickly wants to come in and just close these remarks. But over to you, Charlotte or Rajat.
No,
Thank you,
so much,
David.
David.
Charlotte,
But,
if you
I
want to
think
say a quick hello so people know the
yeah,
leadership of the constituency.
just to say hello and the fact that we are looking very much forward to engaging with all the constituencies to understand better how we can activate the private sector into new collaboratives that can really have a significant impact. So thanks, David, for taking the lead here.
Welcome, Charlotte, and thank you also for all the contributions this morning and for joining us again for this PM session. Colleagues, we have a few minutes. I'm not doing too well in terms of timekeeping right now, but we do have a few minutes for questions, clarifications, your inputs or reflections as members of these constituencies that you may want to share. I do want to come to Kate and Jesse in case they have some reflection as they have been thinking and dialoguing with a bunch of people about the different reviews that they have been undertaking. So over to you guys. Any questions that the group wants to have before I turn to Kate and Anne and Jesse? I don't see any hands, and unless people are speaking and are on mute, in which case do please raise the hand feature if you can. But otherwise, in the interest of time, maybe Kate, I can come to you for your reflections on what you've heard in terms of constituencies as a way of organizing cross-constituency work, and to you and Jesse likewise as well. Kate.
Thank you, Rajat, and once again, thank you for allowing me to just bear witness to that very rich report and the synergies of all that has been presented with what's coming out in this rapid fire governance review. I thought I just should emphasize a couple of things in case it resonates with you, but also to reassure you. I think that there is a synergy emerging. First and foremost, what I believe the governance review will try to grapple with is how to clarify and tidy up a little. What are the propositions of opportunity on the one hand and expectation on the other hand of partners within PMNCH? And you represent, just through what you've described, clear evidence of the enormous achievements already, but further potential that PMNCH has if we can mobilise, engage and focus our partnerships together. The second point, though, emerges is how do we strengthen the value of constituency working, but most notably cross-constituency working. And I suspect the organising frame becomes purpose or target or goal rather than identity, for example, perhaps. I think there are great things about the current constituency process, but I suspect we may need to augment or modify in some way in order that we make best value of you. In my own sense is that in a way we need to think about talent management almost across the partnership and try to reignite our sense of ambition, if you like. The third point, just to really underscore what's already been said so beautifully, is, and I think this is coming through even in the governance review, I'm sure it's much more and much better handled by my dear colleagues working on strategy, but that is the importance of impact in, with and for countries and figuring out an orientation to material change in the day-to-day lives of people, like people live in country spaces, and empowering that change whilst also connecting it back to global actors who also have influence over those day-to-day lives. I think that is the power of partnership, but it needs clear stewardship through the governance system. Ultimately, what we've been hearing, though, is that message which was said beautifully earlier on, that it's time for business unusual. I would say it's time for governance unusual if we're really to liberate the spirit of business unusual. Every system is perfectly designed to deliver the results that it's delivering. And the current international global health system is delivering no progress for MNCH. And that's utterly unacceptable, as PMNCH has said powerfully. I think PMNCH will have to probe itself for system change if it wishes to be part of results transformation. And I think, Rajat, that's in the air, and it will be a challenge for governance review, humbly, but also my strategy colleagues will be much better at it. It'll be really important that we land this well and faithfully to the energy we've just heard. And I thank you for it. Back to you, Rajat.
Thank you. Thank you for that, Kate. And Jessie, I see you're on camera. Would you like to come in? And Anne as well, if you would like to.
Sure. So as an evaluator, I'm always very hesitant to share findings before we've done an analysis, especially given the very complex nature of your work. But with that said, I'd say, we have certainly heard a desire for even stronger alignment and synergy across members. We've received to date a lot of feedback on how, possibly to better leverage and better optimize the digital advocacy forums, the CANs, and other initiatives, for example. Many of you all have pointed to the Global Forum for Adolescents as a successful example of really leveraging the diverse membership and, sort of building a bridge between local and global, as Maria Antonietta rightfully called this type of work. And then finally, I just say very early findings also potentially, point to the role that the partnership played in giving coverage to members on issues where there might be alignment, but where maybe national level partners can't necessarily be such a bold voice on an issue. I'll end there for now. More to come.
Thank you. Thank you for that, Jessie. Anne, if you would like to come in now. I don't hear you, Anne, in case you're trying to speak. I don't see she's online. She might have dropped off.
She might have stepped away for a minute. Yep.
Yeah, that's That's okay. We can come back to Anne if she joins us later in the conversation. Colleagues, as we move into the next part of our town hall series, just to reiterate and urge you all to please find 20 minutes of your time. Do complete that survey. The link is in the chat. It will be sent to you again via email. And also please do reach out to Anne, Kate, Jesse, in case you would want to have a one-on-one with them. I'm sure they will very much appreciate that. We will appreciate that as Secretariat as well. And with that, I would like to move us into some of the key highlights of overview of what your Secretariat and you all have been up to. And we have a bunch of updates we wanted to share with you. You have heard a little bit about some of these initiatives in passing in the conversation today, but you have also heard it from us in the different spaces that we have interacted. So we have about 5 different pieces of updates to share with you. The first would be looking at the tactics of political engagement and how we are leveraging them. You'll hear about CAPS, GLN, and the parliamentary engagement work. Next, we will swiftly move into the work on maternal, newborn, and child health and the World Health Assembly resolution and how it's being implemented and what are some of our plans regarding that. And then next, you will hear from us about the work on adolescent well-being and SRHR before we conclude with some of the ideas we have about how to strengthen communication for impact that we've been talking about. I will stop speaking now and give it to my colleague Ilse to take us through the next set of slides, please. Ilse, over to you.
Thank you very much, Rajat, and really a privilege to share some of the highlights and updates of this work. And as I speak about the Global Leaders Network and the country collaborative advocacy action plans, the first really to start with sincerest thanks to our partners for their key contributions, leading, supporting, and thinking through how in the best way we can support the country actions. And Kate, as you were saying and also said during the accountability breakfast, how to ensure that next year when we meet again, we have really advanced and done it in a meaningful way. So when we are talking about the Global Leaders Network, and I'm very happy to see Lebo Lebes from South Africa Mission here, this is positioned as the first and the only Southern-led global health diplomacy initiative, which is chaired by His Excellency President Ramaphosa of South Africa and supported by a number of heads of the state, and I will talk in a minute. And this is for advocacy at the highest political level. Then this linkage to the global and national, it's why we are talking about the Country Collaborative Advocacy Plan Initiative, which is the country-focused advocacy through aligned efforts led by coordinating partners, national partners, advancing the implementation of policies and commitments already made and seeing where additional commitments need to be mobilized. The next slide, please. So let me start with the Global Leaders Network, and this is very, very exciting to report that, as probably many of you saw during the UNGA in September, there was this landmark event hosted by the President Ramaphosa, which we organized, and we saw the commitments from additional 6 heads of the state from the Africa continent, including Nigeria, Liberia, Kenya, Ethiopia, Senegal, Sierra Leone, and Tanzania, in addition to the Prime Minister of Denmark, who already made her commitment last year. So, and through this event, which many we heard saying it was extraordinary, where the heads of the states and also being in presence that the principals of the UN, the UNFPA, WHO, and UNICEF, and as Maria Antonietta saying, also with the voice of the youth and the NGOs, the heads of the state really made this pledge and called for renewed political commitment for the women, children, and adolescent health if we want to achieve the SDGs. And here very clearly stating the key issues around the SRHR, including abortion as a basic right. Also noting the importance of equitable access through the PHC services and highlighting the need for investments and also sustained financing through the multi-sectorial engagement and the partnerships. So we are very excited to support these efforts of the heads of the state. And also other element important and linked to the PMNCH work is that specific countries where they will pay additional focus is the 11 focus countries, which are exactly the same countries where we are engaged through the CAP initiative. And this is to the notion to listen to and respond to the needs of the countries and partners. So on this slide, you can see about the CAP plans, which is well advanced in many of the countries. And I saw a number of the partners leading and contributing to these efforts, Miriam, Pascaline, Marlene, and others. It's really been led and contributed greatly by the partners. And here maybe 3 points I would like to highlight what we are learning. The first one is to be aware what commitments governments have made, and then leveraging these through the joint advocacy efforts. This is also relating to the Garrett's point, because adolescent commitments were made so well, and even new ones this year, and how then they are implemented and mobilized, as well as on the WHA resolution, which my colleague Etienne will speak later on. The second is linking this in of the governments. So these processes not stand alone, but they are integrated in country processes and the timelines, the reviews. So to really ensure that sustainability. And very importantly, building on the synergies. Again, like working closely with Every Woman, Every Newborn, Everywhere initiative, the former INAP EPPM, the GFF efforts and the others. So it's more consolidating the efforts. And then also seeing how we can strengthen with additional partner engagement, existing multi-stakeholder platforms, and ensure these more regular reviews of the progress. And as Anne alluded to, using the digital platforms so that more and more partners can come in and join the forces. The last point here to mention is that what we are also doing is quarterly learning, so to have this cross-country learning as well. On the next slide, very much also through these country engagements is in each of these countries, we are also engaging with the parliamentarians, acknowledging the important role they play in the budgets and in the legislation and the oversight. But in addition to the country work, a few highlights what we have done also over this year. And this is to acknowledge the excellent collaboration with the Interparliamentary Union. Marlene already mentioned the workshops in Zambia and Malawi, leveraging the ART constituency partners, doing a new podcast series, seeing how to deliver the message and key asks so the parliamentarians can kind of be clear through the very different needs and the asks from them, especially in this resource-constrained environment, and also how to ensure sustainability of this commitment for women's, children's, and adolescent agenda. The second area we are working on is through the global convenings of the speakers and the representatives of the parliaments across all of the regions and the world. And these are IPU General Assemblies convened twice a year. And here the PMNCH is engaged in ensuring visibility of the women's and children's health as a priority issue. And then also, for example, in the last convening, we co-organized with IPU and WHO a workshop on SRHR, how to position SRHR as really critical and key element in the parliamentary debates. This as well is linked to the uptake of the WHA resolution, which is a global resolution, but how then to use that and leverage at the country level. And the last one is an example of how quickly and being nimble and act on an issue. At the previous assembly, there was a concern raised about upholding the FGM ban in Gambia. So the PMNCH very quickly worked together with the IPU, released the joint statement, engaged in advocacy, and also facilitated the exchange with the Egypt country cross-learning to ensure that this doesn't happen, which was successfully achieved. So with this, these are a few highlights and huge thanks to the partners and many of you supporting these efforts and really exciting progress we can report on. Thank you very much, and back to you, Rajat.
Thank you, Ilse. And really extraordinary effort, and shows the power of the collective that we all belong to, and that we can lift these heavy agendas together. Over to you next, Etienne, for update on maternal, newborn, and child health and the WHO resolution.
Great. Thank you so much, Rajat, and very warm greetings to colleagues. Thank you for joining this call. And it's very refreshing to hear the innovative ideas and this call to be bold, to be unusual in our approach to cross-constituency collaboration. I think it paves the way forward very nicely for the future of PMNCH. And I think this is very critical for our activities and priorities in the portfolio around maternal, newborn, child health. We are guided by this very important resolution on the acceleration agenda for the SDG targets 3.1 and 3.2. I do want to commend the fantastic leadership of Somalia in driving this agenda forward, mobilizing stakeholders and 51 member states that ended up co-sponsoring this resolution. So important momentum for this agenda. PMNCH really played an active role in spearheading discussions and mobilizing support in the build-up to that resolution. So Marie Antoinette, you alluded to the role that civil society has played also. So we partnered very closely with CSOs, but what we did is we actually convened a network of stakeholders spanning across constituencies. So we had CSOs, HCPAs, donors, private sector, and adolescent and youth representatives within that network. So very interesting for the ongoing conversation about fostering, stimulating cross-constituency collaboration moving forward. So what we did there is we supported a set of key advocacy asks for partners to work with member states to ensure that there's strong language around the continuum of care, around the life course that is kept in the resolution. So we're very pleased to see explicit language on SRHR, for instance, in the final text. And that network was really active in mobilizing countries and trying to convince countries to be official co-sponsors of the resolution. What we did also in that space is we organized a briefing for member states to unpack the content of the resolution with a view of driving that agenda forward. So shifting gears, we're trying really hard to move the implementation forward for the key issues that are raised in this resolution. We are mainstreaming the implementation agenda in our events, in our campaigns. It was the focus of our Lives in the Balance series during WHA, the side events that we organized on issues around investments, around policies and service delivery. Similarly, for UNGA 79, we had importance events across the continuum of care, where we flagged the importance of mobilization to support the implementation of the resolution. Next slide, please. So it's really this approach of mainstreaming, of making sure that we use the momentum of the resolution in all of our functions, all of our activities at PMNCH. So that is true for our knowledge approach, feeding into our comms, our advocacy, our campaigns. We have developed, for instance, key advocacy asks for WHA, for UNGA. We've worked to mobilize the MOH of Somalia and Ethiopia, who have co-signed a Lancet Global Health paper on the importance of the resolution, and similarly, the really critical networks of IWNA, CSA, and I want to also reach out to Align MNH. I see there's colleagues that are there that are really strong supporters of the movement towards the implementation of the resolution. And so here we're using advocacy briefs, we're using knowledge translation approaches to foster and support advocacy and accountability in that space. So for instance, we are releasing a brief on human resources for health in November and financing in December. Those products are pegged to the policy dialogue series that was alluded to in this town hall. So we had a really interesting one yesterday on service delivery integration. I think that's a key agenda for MNCH, this question of integration and coordination of high quality services and interventions.
Moving forward, we have another one in November on human resources for health, and our final for this year, for this quarter, is on financing on the 10th of December, really leveraging that important question of more and better investments for MNCH and the life course approach. Next slide, please. So finally, just a few words on the content and some of the priorities around this question of implementation of the resolution. One is the issue of financing. We took an active role in knowledge translation and support to the launch of a new Lancet Commission report on investing in health. And the report was launched at the World Health Summit a couple of days ago in Berlin. And so we are using this for our advocacy to leverage better and innovative financing for women, children, adolescent health. Second main issue is around climate change and the rising evidence that we have on impact on MNCH, not least the issues on air pollution and also heat stress. So huge impact on poor maternal newborn child health outcomes, and also the critical question of stillbirth, which is inherent to this portfolio. So we're taking an active role in advocacy around COP29 in terms of the intersection around climate and MNCH. And then similarly, we are targeting our policy dialogue, our first policy dialogue for 2025 on this issue of the intersection between climate change and MNCH. We have talked a lot this morning about the uptake of knowledge for advocacy and accountability at country level and the need to contextualize the evidence. And so we are moving also in that direction with a pilot on contextualizing our advocacy brief series, starting with the climate change one and working with partners at country level to leverage local data and contextualized data for better decision. And then last but not least is the huge priority and challenge around humanitarian and fragile settings. We're very concerned about the evolving geopolitical situation. And so this is an issue that requires our collective effort in upholding essential services, including MNCH, SRHR, and adolescent health and well-being in those settings, in those very, very difficult conflict settings, but also the question of humanitarian to development nexus as well. Thank you very much, and back to you, Rajat.
Thank you, Etienne, for that very comprehensive update and just laying out all the different plans that we have and the different tactics that we are bringing to bear to ensure that the implementation takes place of this magnificent resolution that was passed at the World Health Assembly. Colleagues, I guess for the next set of updates, you probably were expecting my colleague Anshu Mohan, who's not here, unfortunately, because of a situation she's dealing with at the moment. She was there with us this morning. So I'll do my best to be Anshu for the next few minutes before as I take you through the update regarding the work that we are doing on adolescent health and well-being. And as you know, this is a portfolio of work that the partnership has been working consistently putting these issues regarding adolescent health and well-being in the global policy space. You heard from Garrett some of the work that we have been doing through the AY constituency, the convenings that we have put together. But importantly, a key contribution that emerged out of the work that happened in the Global Forum of Adolescents last year was the work that the team has been doing in terms of building an investment case for adolescent health and well-being. And this is rather innovative work that the partnership has been shepherding in different areas and now bringing it to the work on adolescent well-being. You will see that magnificent figure that is put in front of you in terms of the cost of inaction, that the benefits that are foregone over the period 2024 to 2050 is about $4.1 trillion that our modeling calculations have presented, or 7.7% of GDP. If you do try to read the fine print under that figure, it even is rather stunning, as Anshu often calls it, it's a telephone box of a figure that's about $110 trillion in present value terms that we tend to lose from the world economy and the potential for not addressing the issues related to adolescent well-being. A key component of this work was identifying what are the different domains through which we calculate the adolescent well-being and the investment case therefore. And as you would look at it, it is a complex mix of issues, some within the health sector, health, SRH, nutrition, non-communicable diseases, TB, myopia, but also issues outside the health sector, such as education, road traffic injuries, and therefore begetting the need for a multi-sectoral and cross-sectoral emphasis to deliver on the veracity of issues that we are talking about. We did realize early on in this process that it is one thing to put a global investment case and cost of inaction together, but it is also equally important to show how this will work when we are looking at these issues at the country level. And with that in mind, within the resources that we have available, we've been working on national investment cases for 3 countries that are Colombia, India, and South Africa. And very interestingly, they're all, at different stages of launch. I had the privilege of joining the launch for the India adolescent well-being investment case early on in this year, about a couple of months back. But we are also working very closely in terms of parallel work that is happening in terms of development of measures and framework on how we can actually get some real-time data in this regard, and working very closely in that with our sister department at the World Health Organization, the Maternal Child and Adolescent Health Department. So watch this space. There is a lot happening within the adolescent portfolio on how we are trying to do. The big win for us as a partnership and for you all working in this area has been the country commitments that we have been able to generate and the regional commitments that we have been able to galvanize over these last few months and years working on these things. And what is rather remarkable is not only as you see the geographical spread of these commitments, which are spanning the different regions of the world, but these are not only coming from low and middle income countries, these are also coming for countries in high income categories and also coming from regional bodies as well. And this gives us a lot of potential to keep on building, but also something that we've been hearing in the last hour and a half now in our conversation, building cross-sectoral collaboration, cross-constituency work that we have been trying to do. And so how do we then link in the work that we are trying to do, looking at adolescent health and well-being from an adolescent SRHR perspective, and looking at the impact it is having from teenage pregnancies perspective and leading to high number of women dying or young girls dying in childbirth. A related conversation that we wanted to have with you is about the work on sexual and reproductive health and rights, an area of work that the partnership has done some inroads in the last few years, but an area of work that has lacked coherence and consistency in the way we work on these issues. We have been ad hoc at times in how we have talked about it. Some have been critical that the partnership has been cherry picking issues related to SRHR and lacked a coherent voice on how we wanted to address these issues. With that in mind, we had the privilege of having Anne do an assessment for us and develop an advocacy roadmap, which threw up a variety of things, starting with, so what would be the value add if PMNCH had a more integrated approach to how it looked at issues around sexual and reproductive health and rights. So nothing in this should be a surprise to the audience right now. The first and foremost is the political capital and access that PMNCH has. You just heard colleagues give some wonderful examples of our ability to convene cross-sectoral advocacy, the WHA resolution, our ability to look at high-level advocacy, the work from the Global Leaders Network, which Ilse talked about. If you look at the speech of President Ramaphosa in New York, it was very deep in variety of ways, but what it actually did present what an integrated approach to these issues look like while he talked about the burden of unsafe abortion on high number of women dying in childbirth. So political capital and access, a credible voice, which comes from you, the broad-based network that we have in the number of 120 plus countries that we work in through these 1,500 partners and 10 constituencies that we are able to leverage as well. And indeed, the convening power, which you all are very much familiar with, and the fact that we are a network that work from the local to the global level and can connect the two in an ongoing manner so that these issues remain continuous priority. The thing that one of the key things that we did identify that the partnership needs to look at is how do we address the ongoing attacks and the backlash on sexual reproductive health and rights, gender equality, and human rights. And what is the role that the partnership can play in this regard? And one of the key things, as an example that was given to you in the passing a few minutes ago, was the work on when a private member bill in Gambia was presented to revoke the ban on female genital mutilation. The partnership was able to leverage not only its relationship and working closely with the Interparliamentary Union to get a statement out condemning such a move from happening, but also what we did thereafter to make sure that that legislation did not pass is rather phenomenal, because the partnership was able to build a cross conversation between parliamentarians from Gambia with parliamentarians and experts from Egypt to learn from them on how we can address these issues. That is just one example on how we were able to effectively achieve change in a very contested situation. How can we do more of that? Can partnership bring its soft power to deliver on some of these issues, to broker conversations on complex issues? And what might that look like as we look into issues and the complexity of it, not just in context of issues around unsafe abortion or LGBTQI issues, but also the complexity of challenges that we are facing today when we look at issues around access to contraception or looking at issues in context of child marriage or FGM. So a few portfolios of work that have been identified that we will be working as an immediate priorities, of course, working through convening such as the policy dialogue series that has been mentioned to you, webinars and consultations and providing briefings on these topics, but also doing partner mapping and identifying is there ways in which we can undertake some capacity building work, bringing experts like Ann Chiara, the president of FIGO, bringing people from ICM, ICN to dialogue on these issues so that we can make the case with those that then go for negotiations on how we can meaningfully address these issues. We are also looking at communication channels to further advance the agendas, podcast series, but also something that I guess some of you might be familiar with is how we are able to provide small grants for organizations, researchers working on these issues at country level to leverage the potential on how we might be able to advance the specificity of these ideas. Colleagues, very briefly to highlight to you the communication plan and agendas that we are trying to drive. One of the key things, as you heard us say, that the board asked us to do was to focus intently on how we will accelerate the reduction of maternal, newborn, and child mortality and drive the implementation of the resolution and address the drivers of that high levels of mortality that we have been talking about. So for us, one of the big challenges was how do we do that and how do we bring our different platforms and our techniques together to deliver on that. So one of the things that we did do is look at our communication strategy and approach. So how can we move away from just being an amplifier or a loudspeaker, if you may, to strategically use PMNCH channels to advocate at country, regional, and global level to effect meaningful change so that we have outcomes that match the commitments that have been made. We have seen enormous progress in the way we are approaching these things. We had, as Etienne mentioned, yesterday a dialogue looking at, which is captioned as Ready, Set, Implement, where we were looking at service delivery aspects. In November, we are hoping to look at health workforce issues. And in December, we are hoping to look at issues in terms of healthcare financing. And we are hoping to also look at other issues as we come into the next quarter of 2025. What we want to do is to have a very clear goal that we want to achieve is increase in visibility of maternal, newborn, and child health issues and creating a sense of urgency that there is no time to wait, that women and girls are dying and are dying on our watch. And we do need to do something to address these issues and the complexity of challenges that result in them dying in childbirth. We will be doing that through a series of activities and online tools that we are invoking in this regard. But we are also looking at you for your advice and help for us to amplify these messages and to reach those in the positions of power so that we can effect the change. That is all we wanted to share with you at this point. And at this stage, I will stop sharing the screen, but really opening it up to you. You've been hearing us and the different presentations for the last hour and 45 minutes now. And any reflections you would want to share or any feedback to me or the team at the Secretariat on how we can service you and this agenda better. Over to you all. Mona, please go ahead.
Hi there, I'm Mona from the University of Oxford. First, just to say, this is really, really, really impressive. So big well done, big round of applause. I have just 3 very quick points. First is on building a demand. So I was wondering what PMNCH is doing to promote the agenda in countries where there's less political will, so that we make sure that countries that are left behind are not left further behind. Second is just a recommendation from me, is that cross-cutting considerations like gender, climate, and conflict may have a place in a governance structure. So I'd like to see that a bit more emphasized. And finally, reflecting on the Global Forum for Adolescents in particular, one main advantage, I believe, and unique advantage of this network, I believe, is the semi-structured advocacy plans. So allowing for that level of adaptability. So even though you highlighted specificity was one of the main feedback you've received, I do think there is an advantage to leaving some room for responsiveness. Thank you.
Thank you so much, Mona, and spot on, really. And that's the intent, indeed. And I think as we address the urgency and the plateauing of issues, that how do we keep on being agile so that we can adapt and respond to new and emerging challenges as well. And I could not agree with you more. Our capacity is limited, but our reach is enormous. And that's what I want to focus on. When I say 1,500 partners, that's rather magnificent number in over 120 plus countries that we are active in. The challenge for me as the director, but all of us working in this space, is how do we use that? And especially in situations that you said are contested, and is there a way we can provide partners in those countries with ongoing support, with tools, with capacity building, with catalytic funding, if we can, to continue to advocate for these issues as situations get more precarious. So thank you for the feedback. It's well noted, and I'm sure our reviewers are taking note of these feedbacks as well. Lovely to see you, Joya, and welcome. It's been a while, and over to you next.
Hi, thank you. It's lovely to be seen. Lovely to see you as well. This is amazing. I'm so excited to really be in community with you all. And truthfully, we have this phrase in the Black community where we call it code switching, right? Where we have to be in one space and talk. So it feels like what you were dealing with is the code switching of being an American, dealing with the U.S. and the UN and these structures. So when we have a very strict U.S. government, we don't talk about abortion, right? So like think about right now, just thinking about the president of South Africa doing this very robust statement talking about abortion, and we couldn't have gotten that done for 4 years here in the United States, which seems odd as we're supposed to be this beacon of the future, and yet we were going backwards. And so that's a long way for me to say what I have to do as a Black person in the United States, talking about maternal mortality, is say, even when the larger government doesn't want to talk about it, I need you not to switch how you talk about it for the globe. We cannot switch just based upon, I know the funding makes it difficult, but thinking about our statements and how being able to watch what's supposedly a more conservative government talk about the full range of reproductive options, whereas we could not do that in the United States, tells you that we need this structure to not use the United States as the beacon of where we're headed. We don't even have health as a right. Even this whole like the parliamentary union, I'm just thinking about how we're not a part of that because we want people to be Congress and not Parliament. Like we're participating in a U.S. crazy code switching moment that I don't want this organization to be a part of. And I don't know if that ramble made any sense to any of you on this call, but that's how I'm feeling when when I'm watching this. Like, why aren't we a part of the parliamentary union? Oh, I know why, because we don't have, so just all the ways that shows up in our work. I don't want it to harm how we do our work together. Does that make sense?
Makes perfect sense, Joya, and actually, and this is where I think the value of this partnership becomes even more important. How do we prevent for that code switching to happen, and how we can continue to leverage as and Chiara, the president of FIGO, said this morning, I don't know if she's on the call right now, very eloquently that we need to continue to fight, and we need to continue to fight so that these issues remain relevant, not just to 2030, but far beyond, because our work is hardly done. And as we look into these issues, it keeps on getting more complex. Years back, you and I engaged in a conversation which was looking at mistreatment and abuse for Black women in United States of America during childbirth and the impact it was having on the levels of mortality and morbidity in US, and how do we address it. Thank you, really, Joya, for joining us and for that feedback, and which we do take it to heart. I do want to, Elaine, I don't want to put you on spot, but you make a very important point which we have barely touched in our conversation today. We did have a passing reference of the humanitarian context, but you are someone who has dealt with it in depth, and you have made this point on the chat. And I wonder if you would want to share some further reflections with us on both the situation, but where you see we as a partnership can come stronger and support you at IRC and other partners beyond. Elaine?
Rajat. That's a hard way to be put on the spot. I think that the humanitarian sector is in a little bit of a growing pains space, if you will, in the worst way possible, of course, like as we continue to see an increased number of crises, the increased scope, scale of resourcing that's needed. And then as you see in the rest of the sectors writ large globally, this real push to integrated care, higher quality of care, investment in health system strengthening and localization, those are all really complex things to then do really well in the midst of a crisis. And I don't want to suggest that the humanitarian sector isn't well on its way to doing that. There are amazing success stories, but I think we are several years behind the development sector when it comes to figuring out how to elevate our success stories, how to make our case for resources, how to identify the best ways of cross-sectoral collaboration. And PMNCH with its convening power just has such a strong potential there for us. I mentioned the two constituencies that have engaged with PMNCH in the past, but perhaps aren't solid contributing members, and that's IWOG and then the SRH task team that exists under the Global Health Cluster. But even then, that's SRH. That's not necessarily bringing in the child health community. It's not necessarily doing enough to elevate the public health, nutrition, WASH needs as well. And so working with PMNCH to figure out what are those other constituencies that we need to be engaging with and how, I think that would be really valuable. And then truly, I hate to say it, but like that convening need is still there at the end of the day, that no one agency has the resources available right now to bring all of the necessary stakeholders, thought leaders, representatives, and particularly the voices of those that are most impacted within these vulnerable communities together to one place to figure out the best practices, the lagging areas of concern. So looking to a global partnership entity to help make sure we're taking that comprehensive approach would be really valuable. I will just say there's a lot in the works right now that I think will help set a future agenda for the SRH and humanitarian sector for the next few years. I think can align really well with this 2026 to 2030 timeline for PMNCH. The task team under the Global Health Cluster is doing 4 evaluations right now of how well the minimum initial service package, the MISP, which is this package of essential baseline SRH services that is a global standard for delivering within any acute emergency, We're doing 4 evaluations currently to see how well the MISP was delivered in recent responses, actually Ethiopia, Mozambique, Gaza, and Chad. So there will be in mid-2025 some really impactful high-end learnings to emerge from that with implications and recommendations for global and national level moving forward. And those recommendations will be for the global health sector, the humanitarian sector, but also very much for policymakers, for ministries of health, for professional associations. So calling on PMNCH to help us figure out how to package and elevate that. There similarly have been a couple studies that have emerged recently that have a lot of important overlap with other sectors across the health system. We just finished as IRC a research study looking at the effectiveness of the referral pathway from basic EMONC to comprehensive EMONC, BMONC to CMONC facilities in 2 humanitarian affected countries. And we've disseminated those learnings in a couple places, and each time the response is like, oh, wow, these findings are really similar to what you would see in a hard to reach rural district of a development stable setting. Like, yes, that's true. We're not looking to reinvent the wheel here, but we need that collaboration and that learning from others to figure out how do we take those successful opportunities and adapt them accordingly into our settings. So again, just the forums to be able to have those high level dialogues, but also that ability to reach down into ministries of health to make sure that the humanitarian representatives are included in national working groups, in work plans, in ENAP, EPMM, country acceleration plans, right? Like, certainly we are the partners that have the best access and know best what's needed in those affected districts. And so bringing us to the table when we don't have the resources to bring ourselves is always going to be really valuable. So I know there's a lot of like really high-end big asks. There's nothing that we haven't discussed, of course, before. But I am really hopeful, again, kind of with all the findings we've got emerging in the next year in particular, that we can play that much more impactful role in the 2026 to 2030 strategy. Thanks, Rajat.
Thank you. No, thank you, Elaine, and really very grateful for you to share that feedback. And I won't even apologize for putting you on the spot, because we did needed to hear that. And indeed, how can we as the partnership, as the platform, service that need better is where we need to know, because as the unfortunate reality of our present shows, this is the new normal we are living in. This is where 60% mortality is coming from. So if we are not addressing these issues intently, we are not doing our job fully. Joy, I see your hand up, yes. So I will come back to you again, and as we wrap up with final remarks. Please, over to you.
Yeah, just quickly, because Elaine helped me to put more concrete what I was trying to say. So what we figured out with the Black maternal health work in the United States was that we needed to go to a year, right? And so instead of the 6 weeks, and so this is a great forum. So thinking about our convening, like if we made that how do we make that a standard? Because truthfully, what the rest of the United States does is follow what WHO says, which comes from kind of what this group will say. So using our power to not get stuck on when we figure out a thing, like the fact that maternal mortality is not the 6 weeks event, but it happens up to a year later, then using our power to collectively organize around that will help focus a lot of these other institutions. So just, anyway, that's what I was just trying to say. It's like picking a thing that we can focus on, that we figured out that we kind of haven't moved forward as a real policy that could change so much of all of our work. Are you muted for everybody else? You mute? I can't hear you. Might be me.
So I wanted to say, Joya, you have thankfully very nicely queued me up for my wrap up, because that's where I wanted to also focus. Colleagues, first of all, an enormous thank you. You've been very generous with your time, your contributions, and one does not often recognize that a lot of this contribution is being made in your volunteer capacity, that you're coming here, sharing your experiences and giving us feedback. So, on behalf of the partnership, thank you really for joining us and being member of the journey. This is the first of an effort for us to connect more directly with each other, for you to hear from your secretariat what's happening, what's not happening, but for us to hear from you on how we can drive progress further together. I hope and intend to do this more regularly. Very important feedback as was being given right now, and maybe for future ones we identify an issue or a theme and we have a deeper dive around that on how we can leverage, not just looking at big forums and events that will happen at WHA, at ANGA, and so on and so forth, but using this platform to advance our ideas, our strategies, our convening powers together on how we can take these agendas, not just in terms of the spaces that we are familiar with, but the spaces that we are not in together. Thank you so much for joining us. And most importantly, thank you for doing the work that you do to make an enormous difference to women, children around the world. Thanks a lot, colleagues, and have a lovely rest of the day, wherever you are. Goodbye.
Thank you. Bye.
Thank you. Bye.